Welcome to the University of Washington. My name is John Elgin, and I'm the Associate Chair for Faculty Development and Education. I'm really excited to see you here and hope that these videos will help you to explore our residency program a little bit better. We're going to talk in this video about EMS, and I thought that I'd just share a story that really helped for me to illustrate how pre-hospital systems make big differences in our patients' care, and how I was really blown away by the system that I joined when I joined the faculty about 10 years ago. Shortly after I started my job here, I was working at Harborview and got a call from Airlift Northwest, who were at Crystal Mountain, one of our local ski resorts near Mount Rainier, and we're doing CPR on a 19-year-old who'd collapsed while hiking with his friend. They were ultimately able to get the patient's pulse back and transported him to Harborview. And 2 or 3 days later, the patient walked out of the hospital neurologically intact. And as I reflected on what needed to happen for that person to have a good outcome, it really illustrated all the things that I think really makes this region special. The fact that his friend had gotten CPR at school and did good high quality compressions very quickly after his friend collapsed. The rangers who took over from his friend, and then the paramedics, and then airlift, all of those linkages of that chain that really led to this person having a unbelievable outcome given the circumstances. And so I hope this video will help to illustrate to you just how central you're going to be as a member of that community, doing medical control with the Seattle medics and the King County medics, riding along and providing excellent care with Airlift as they pick up patients from all over this region. And for those of you who have more of an interest in EMS as a career focus or something that you'd like to explore, you're going to learn a bit more about the EMS track and the really unique opportunities that you'd have as a member of our team. You're going to hear from 3 of our EMS experts. Dr. Michael Sayers, our section head, and is the medical director of Seattle Medic 1. Dr. Richard Natchett is the medical director of Airlift Northwest. And Dr. Andy McCoy is the medical director of Shoreline Medic 1, as well as the medical director of AMR Puget Sound. I think you're going to learn a lot from their reflections on what makes this system really unique and special. And again, I'm glad that you're here and eager to learn more about our program.
To me, one of the key things that's different about EMS here is the training that the paramedics receive. So we have our own paramedic training program, and residents have the opportunity to participate in contributing to that paramedic training in a variety of ways. And they then get to help take care of patients who were cared for by paramedics, intensive care paramedics, and show up in the emergency department maybe alive when they otherwise would have been dead. So sometimes patients arrive here that in, I believe, other systems wouldn't have survived. And consequently, there's just more sick patients here because of the EMS system that we have.
So one of the unique opportunities I think the students have here is to be involved with Airlift Northwest, which is the air medical transport program for the University of Washington. Being involved in helicopter EMS, scene response, as well as inter-facility critical care transport. It's pretty rare to actually have this opportunity in training programs. It's not universal that you have exposure to air medical transport and HEMS. So that's something that's unique, definitely to this program. And pretty much every resident in the program has an exposure to air medical transport as first and second years. But one of the things that's unique is sort of talking about, and I'll kind of talk a little bit about the track as far as if they self-select as senior residents into the Airlift Northwest EMS track, is they get to be basically a flight physician and to train to be a functional crew member in the back of a helicopter, in the back of a fixed-wing aircraft. And that's something unique because they're exposed to sort of medical care in fairly austere circumstances, in a very small space, in the field setting, in smaller critical care access hospitals. And they basically get to interface with all sorts of medical systems, from smaller county EMS agencies to, again, small rural hospitals. I think that's a huge attraction to the residents who select into this track, is they get a lot of hands-on experience from this, which again is unique, I think, unique experience that they can't get in a lot of other places.
I think our residents really, due to the small number of paramedics that we have, our residents really get the chance to develop a close relationship with those pre-hospital providers, the flight nurses, the paramedics, and get to know them on maybe a better level than you get to in places where there's thousands and thousands of paramedics. And that fosters a relationship where they, on their next call, they want to know how the patient did that they just dropped off, and they genuinely want to learn and figure out how they can do their job a little bit better in the pre-hospital environment. And they view residents as a really highly trained part of that team, and able to give them some feedback and some information and some ideas about what was wrong and how could they have picked up on that in the patient's house when they were first assessing them, and how can they do an even better job next time. And so I think that relationship that develops between our residents and our pre-hospital providers, both on the flight and the ground side, is really a fantastic relationship, and one of my favorite parts of our residency.
So our system design is that we have a very small number of intensive care paramedics, that's the label that's on their diploma, that get trained in a program that focuses on experiential learning. So they really learn like residents do. They have classroom experience, and sometimes residents have the chance to teach those if they want to. It's not required, but they have the opportunity. And then starting basically on day 2 of the paramedic training program, they're out riding on the paramedic units. And the residents get a chance to see that. And then, as Andy McCoy just pointed out, help those students learn. So that by the time the program ends in July each year, our paramedic students have had roughly 2,500 plus hours of training, working 60 hours a week, just like residents do, seeing patients and getting a lot of repetitions. And then when they graduate, they go to work for one of the EMS agencies in the region, whether it's Seattle or Shoreline or Redmond or one of the other communities. But they still have that link back to their home base where they trained at Harborview Medical Center. And consequently, they want to bring patients in, and they get an opportunity to just take care of more sick patients. And what the residents add to this equation is the residents went to medical school. So occasionally there's an interaction where they're on radio with the paramedic or on a phone call with the paramedic, and they can really add value in terms of seeing a patient or visualizing a patient in their own minds about what's likely going on, and then guiding the paramedic to improve that patient's care because of some knowledge that the resident has based on their experiential learning through the years as medical students and residents.
And the one thing that's really unique to highlight is the coverage area that we have. I mean, we cover the entire WWAMI region. All 5 states basically are within sort of the scope or the coverage area of Airlift Northwest. So you get to see sort of the wide variety of type of patients that you would encounter sort of in this sort of area. So that's, again, something that's extremely unique, I think. Even other flight programs in the country can't really compare to the amount of area that we end up covering as an academic sort of flight program.
Yeah, I think our graduates really understand where their patients come from in a more in-depth way than many graduates of other emergency medicine residencies, and our folks, they understand, the housing situations that patients come from. They understand the small critical access hospitals that they've flown to with airlift and seen that have 2 beds in the whole hospital, and how those resources are really limited. And if you're picking a patient up out of there, it's almost like you're picking them up at their home. They've seen a doctor, or they've seen a nurse practitioner or a physician's assistant, but they may not have had much blood drawn yet because the blood draw person was at home and had to come in, and the patient was sick, and so airlift was called. And these are common scenarios, and they really allow you to understand the breadth of emergency medicine that's out there in the world, and then a little bit of the depth as you start to see critical care in these critical access places. And Ketchikan, where I flew as a fellow and picked up a septic neonatal patient. You really get to see some pretty crazy scenarios that are out there that are part of real world medicine and real challenges that emergency medicine clinicians face on a daily basis.
So from our side, we have a wealth of observational data. So we maintain a registry of every cardiac arrest case. We maintain a registry of every patient who has advanced airway management. And there's like these big treasure troves of data that residents can use if they want to perform scholarly activities. So we've done that in the past with residents. We also collect data on other kinds of patient conditions in conjunction with the trauma registry. We have a really interesting data set that we're currently working on, looking at every breath a patient gets and measuring the end-tidal CO2, and looking at those relationships versus patient outcomes.
And the track's really designed to involve residents in the breadth of EMS, so they get some experience in flight, they get some experience in ground, they can sort of select which type of in-depth experience they'd like. Then they also are pushed to do a scholarly project or to become more involved, to be part of protocol development or guideline development, and really push forward into sort of taking a leadership role in the EMS world here in this part of the country, and really understanding what's involved in all that and how they can make a contribution to making pre-hospital care a little bit better.
Flight medicine is the gateway drug to EMS. So they all want to fly. Not everybody, but the vast majority find that to be really what they want to do. And it's the chance for a young physician to really get engaged in providing care, to being a player on the team. And so that's a great place to start. You want to know how to play the game. But if you really want to have influence, eventually you want to be the coach of the team. So for those who want a more advanced opportunity to kind of learn a bit about the coaching side and how do you have this workforce of, I don't know, Rich, what is it, 100 flight nurses roughly?
About 110 flight nurses, yeah.
110 flight nurses, or in the city of Seattle, 60 some paramedics, and how many EMTs with AMR, Andy?
Oh, it changes by the day, but somewhere between 500 and 600.
Right, so you have these big groups of people that you're working to influence as the physician leaders. And so getting exposure to how does that work? How do you leverage yourself to have these workforces to deliver outstanding care? Getting exposure to that is an important part of the EMS track.
I think we try to get the residents involved at a pretty in-depth level in everything that happens in EMS, both on the flight and the ground side here. And I think we have a really great group of EMS faculty, as well as a generally great group of faculty across the board. The mentorship that's offered, we have a mix of senior and junior faculty on the EMS side, and we're able to kind of relate to residents and the challenges of their schedule and their lives, and the stresses that they have, and still try to keep them involved in a way that is meaningful, where they understand what's going on and they're able to make meaningful contributions to each of their projects and each of their areas of interest, and really help us to do an even better job caring for patients and developing ways to make care a little bit easier.